Have you ever experienced an idea that truly affected your life? Something so important, yet so unexpected, so life-changing, yet so improbable, so true, but against everything you ever thought you would believe, and so against what people accept that you were almost embarrassed to tell it to anyone. I'm not sure if you have, but everybody on that video has, and so have I, as I will tell you soon, along with thousands of others who have been helped by the groundbreaking work of Dr. John Sarno. Dr. Sarno has changed the narrative of our minds and through that, the trajectory of our lives in the most important of ways. But we are here tonight, close to 1,000 people are here tonight, because one of those patients, one person whose life was derailed, partially destroyed by back and leg pain, and who was granted a new lease on life by Dr. Sarno's teachings, that one person had the passion, courage, commitment, vision, and kindness of heart to imagine this gathering. After his own experience, he decided to invest his heart, soul, and finances to do as much as possible to make sure that no one suffers unnecessarily again. To make sure that no one is resigned to a life as a shell of themselves due to chronic pain anymore. And that no one loses the vibrancy, beauty, and spark in their soul because of a solvable chronic pain issue. A chronic pain issue that is often reinforced by incorrect medical analysis of well-meaning but misinformed medical professionals. It is this man's vision that brought us all here tonight. And it is our hope that this vision and this event will be the beginning of a sea change in thinking and perspective that will bring relief to thousands of people in our community and beyond. It is, of course, a bit irreverent, if not worse than that, for me, our sponsor, or any of our video participants who know little or nothing about medicine to believe that we are qualified to refute accepted medical advice and bring hope to pain sufferers that accepted medical science has given up on, and claim that by changing your thought process and internal narrative, you will actually be cured of your pain. That is a valid argument. And to that, I have two simple answers. Number one, everything we are saying tonight is based on the courageous work of an outstanding, qualified medical professional who worked in NYU for over 30 years. That, of course, is Dr. John Sarno, who we are here to honor, and his disciple, Dr. Rashbaum. Secondly, we are not espousing this theory about back pain because we believe it is true. We are here because we know it is true. This is not a theoretical medical discussion that is open for debate and where the most impressive resume has the final say. Everything you have heard and which you will hear tonight is based on firsthand personal experience. And I would like to share mine. 23 years ago, I was at a school Shabbaton, and I was dancing in the midst of a lot of ruach, and I twisted my back. From that moment on, my life was different. I suffered pretty bad pain each and every day, but excruciating pain every night. I literally had to crawl to the bathroom on my knees because I couldn't get up. I stopped changing my socks because it was too painful to consider bending down that far to change my socks every day. I mentioned earlier I'm a ski instructor. I love sports. I stopped skiing. I stopped playing basketball. Eventually, I went to an orthopedist, a conservative orthopedist, cautious man, good doctor. He said to me, let's take an MRI. I took the MRI, came back to his office, and he said, Ben Sion, I hate to tell you, you're going to have to get surgery. I remember the moment walking out of his office. My life, as I knew it, was going to be over. Sports, activity, expression, dancing. It was defined who I was, and back surgery was going to change all that. Of course, I didn't accept one doctor's opinion. I went to another orthopedist in the city, very highly recommended. Orthopedist saw my MRI, L4, L5 herniated disc, fragmented off. How scary does that sound? The doctor said, you need surgery. Immediately, or you're going to become much more damaged. I went to a third doctor I was really trying to avoid. I went to a neurologist. He saw my MRI. He said the same thing. This is a really bad MRI. It's dangerous. You need surgery. My father, Olav Shalom, always ingrained in me, don't have surgery, don't have surgery. He believed in chiropractors. So, as what I thought was my last resort, I went to a chiropractor who specialized with a special table in Queens in fixing herniated discs. The chiropractor took one look at my L4, L5 herniated, fragmented, bulging disc, and he said, I can't touch your back. It might paralyze you. You need back surgery. Well, that was it. I exhausted my options. I was in such pain. I scheduled back surgery. In the Beis Medrash, in those days, there was a guy who was sitting in the Beis Medrash for years with a special chair. People told me he had a terrible back. One day I saw he had no chair. The chair was a normal chair. Someone said he went to a doctor. The doctor spoke to him. His back got better. I said, I never heard anything more ridiculous in my life. But there I was with scheduled back surgery. I said, okay, I'm going to try even this. So I scheduled an appointment with Dr. Sarno. I walked into Dr. Sarno's office. He begins by giving you a regular medical checkup. I show him, of course, I brought my film from the MRI. I show him the film from the MRI. He looks at the film, and of course I knew what he was going to say, that this is a terrible herniated disc, L4, L5, fragmented. Unfortunately, you need surgery. He turns around to me and he says, son, there is absolutely nothing wrong with your back. I looked at him and I said, Dr. Sarno, by now I know what's going on here. Don't you see the L4, L5? Don't you see that little bulge? Don't you see it's fragmented? Dr. Sarno said to me, he could show me 1,000 MR people who have the same MRI and who don't have any back pain. He said, that is not why you have back pain. I said to him, well, what do I do to get better? He said, what do you like doing? I said, skiing. He said, well, then go skiing. I said to him, go skiing. The last doctor I said, if I go skiing and I fall, I might be paralyzed for life. Dr. Sarno said to me, if you want to get better, just go skiing. Anyway, of course I didn't believe him. I mean, one doctor against four. But he has a seminar you go to after that. So I went to the seminar. A lot of nice-looking people, business people from Manhattan, and they all had back pain. Some of them had already had surgery. They had back pain on the left side. Now the back pain was on their right side. And so I went to that seminar, and Dr. Sarno gave over his theory, which we're going to be privileged to hear in a few moments from Dr. Rashbaum. I said, Dr. Sarno, in the middle of the seminar, I said, if this is true that my pain is based on psychology, why did it happen when I was dancing at the Shabbaton? Why did it happen that moment? And I kept asking him questions because I'm a very critical thinker. I have a hard time believing the things I'm supposed to believe. And I'm certainly not going to believe this really strange theory about back pain. So Dr. Sarno, in the middle of the seminar, looked at me, pointed to me, and said, "You can't ask any more questions." He said, "If you want to speak to me anymore, you'll make another private appointment." I left Dr. Sarno's seminar thoroughly unconvinced, still suffering excruciating back pain. I want to tell you a story. There was once a professor, before I tell you what happened, there was once a professor in college. He was a professor of philosophy. He was a Jewish man, but he was a big atheist. He used to always tell his students why it doesn't make sense to believe in God, it doesn't make any sense. That was his philosophy. He had a Jewish frum student who was in his class. The frum student came to visit him in his professorship office. As he came to the office, he noticed that there was a mezuzah on the door. He asked his professor of philosophy, this fervent atheist, he goes, "Why in the world, if you are an atheist, do you have a mezuzah on your door?" And the professor answered, "I heard it works even if you don't believe in it." And that is exactly what happened to me. I left Dr. Sarno's seminar a non-believer. And 2 days later, I never had back pain ever again for the rest of my life. I'm still here, so far. I think that what happened was that my ego-powered conscious brain didn't want to accept anything he was saying. But my real subconscious inner intelligence knew that what he was saying was 100% correct. I've been back pain-free for 23 years. But Dr. Sarno's effect on me didn't stop there. It actually changed the vocabulary of my life. From that moment and on, I had a word for the type of pain that I experienced when I thought there was something wrong with my back. And the word is sheker pain. The sheker was not because the pain that I experienced was not real. All of us know too well and vividly how real the pain is. It's sheker because the narrative that it creates inside your mind is false. Essentially, it is trying to create a false vision of my health and my capabilities. Since then, over the past 23 years, I've experienced sheker pain in my knee, on a bone spar in the bottom of my leg, in my shoulder. I actually went to doctors, got medical diagnoses, and all the time in the back of my mind saying, "This is sheker pain, this is Dr. Sarno." I've canceled 2 surgeries. I've never had surgery, and each and every time, the pain has gone away. Whenever I experience anything, a resemblance of that type of pain, I just say to myself, Dr. Sarno and sheker. This is my story, and more or less, this is, in variations, the story of thousands of others. Dr. Sarno changed my life and the life of countless others, and we're here tonight to spread that message so that we can help as many people as possible.
I am honored and privileged to be here tonight, and thank you all for coming. And I'm going to take you on a journey this evening about really an area of medicine which has certainly changed my career in only a very good way. Disclaimer, this lecture tonight is for educational purposes only and is not, as you know, a substitute for good medical care. So certainly you should be wise and seek out medical attention to make sure that things are well otherwise. A disclosure, just so you all know, I do receive a small percentage of the royalties from the audiobook, just the audiobook version of The Divided Mind, which is the 4th book that Dr. Sarno wrote and published about this, that is now an 11-year-old book. It came out in April of 2006. We've heard a little bit about Dr. Sarno, but let me add to what has already been said so importantly and eloquently so far. Dr. Sarno is a professor emeritus, a retired full professor of rehabilitation medicine at the NYU School of Medicine. Dr. Howard Rusk, the father of rehabilitation medicine in many ways, he appointed Dr. Sarno the director of the whole outpatient Rusk in 1965. So as you know from the books and from others, is Dr. Sarno, being a product of his times, being a product of the United States medical education system, he figured, okay, so here I am, and certainly one important part of outpatient rehabilitation is pain, so he just started treating a slew of patients the regular old way, with medications and physical therapy and injections and what have you. And what you know is that things didn't turn out so well. It was a very inconsistent, kind of very elusive, ambiguous kind of result, by and large. So what did he do? He decided to do something which is so obvious that it isn't always so obvious. He decided to go back to the drawing board. So he started particularly to do something called a medical history. I don't want to get too much into this and to sort of deviate too much, but certainly one of the unfortunate things in healthcare these days, I think, is all too often you may get this, you may have had the experience yourself as you kind of go to a physician's office, that's if you see a physician at all, versus perhaps seeing a nurse practitioner or a physician's assistant who also could do some very, very good work. And you often may feel like you're kind of moved ahead fairly quickly. Maybe you haven't, but I've heard this from one or two people before. So Dr. Sarno took a careful medical history, which is still such an important, integral part of the not just the physician-patient relationship, but just getting good care, getting good diagnosis. And look what he found. And those of you who've read Dr. Sarno's earlier book, this is all a review for you, is he found that a staggering 88, practically 9 out of 10 people had other types of afflictions in their life which were thought to be, at least at the time, at least in part, if not completely, due to stress and tension factors. Sort of being like a Sherlock Holmes, right? Being a good detective, Lieutenant Columbo from the 1970s. So we thought, well, wait a minute. Could it possibly be that in many or all situations, these common pain disorders could be under the same umbrella, under the same category? And wouldn't you know, by and large, he found that that was true. And there was a greater degree of predictability and even a greater degree of results if you sort of looked at it in this way. And certainly in the last 30 or so years of his practice, he developed quite a following, including probably even on a global level. Alas, not so much among the medical profession, which is quite unfortunate. So let me tell you a little bit about me. And I use this slide particularly because I think that in many ways it can add some perspective to the audience as to why someone like me would be able to perhaps embrace Dr. Sarno's work perhaps a little bit easier than perhaps some of my esteemed colleagues. Well, I'm left-handed, and that's sort of, if any of you are left-handed, you sort of tend to look at the world slightly in a little bit of a different way than if you're right-handed, which is what most people are, and right-handed people are great. I'm not against them. And I was a science guy. In college, I majored in chemistry. I minored in biology, and I almost double minored in mathematics. So you would also think I would be the last person on the block to be sort of doing this kind of work, because that's kind of science stuff, and this stuff wouldn't be. But again, I only mention this because I think it gives a sense that I try to look at things very objectively and logically, not just sort of in a kind of, an unambiguous type of way. And not to mention that, I also did an internship in surgery after medical school before starting to study at the Rusk Institute. I try to keep my finger on the pulse academically. Most medical school departments have something called Journal Club, where we review medical journals, usually within the past 6 months. So we try to stay up on what's going on in all different walks of healthcare. And I've been running that at Rusk for a little over 20 years. And I guess the chairman still wants me to keep doing that. I'm a puzzle solver. That's one of my favorite hobbies. I'm actually just lucky, I guess. My mom and my grandma helped me. I'm a pretty good crossword puzzle solver, and I've often, but not always, say to my patients and their families, I think of what I do kind of as a puzzle-solving exercise. a lot more important than crossword puzzles. These are people's lives, infinitely more important. But having a sort of a puzzle solver's bent on things, I think, could only add value to your patient care. And with all this, I try to also think outside the box when appropriate, which is almost all the time. Dr. Sarno was also, to a certain degree, certainly when he was with Dr. Rusk at the Institute, was an often highly sought-after academician for writing book chapters in textbooks. And this is a book chapter he wrote in a textbook called Therapeutic Exercise. And what he said is that, basically, something so simple, you shouldn't have to say it, is in order to seek good treatment and get good treatment outcomes, you need accurate diagnoses. So my kind of riff on that is, in real estate, what's the mantra? Location, location, location. In medicine, it's diagnosis, diagnosis, diagnosis. You don't go to a pharmacy with a blank prescription and say, hey, pharmacist, just give me a pill. What would you like? Oh, anything. You need to know what the problem is or the right diagnosis. These are some fairly recent articles in some very good journals within the past 10 years. And when we talk about back pain per se, we see that most back pain doesn't have a specific cause. But that doesn't seem to be what many people hear when they come to see their doctors. It's caused this, that, the other thing. And from the arthritis and rheumatism paper in 2009, almost 100%, it's not 100%, but fairly close to that, back pain is of a benign cause. And benign, of course, means not serious. So I think it is clear to everybody that there's a bit of a disconnect between what the academic physicians are reporting in good journals and often what people are actually experiencing in real time in offices. Until, hopefully, there'll be a very sort of landmark paper on TMS medicine. Hopefully I can be a part of that someday. This is probably the most important medical journal paper in the last quarter century that probably almost everybody has heard of. This came out in the New England Journal of Medicine in the summer of 1994. And it was so stupidly simple. No fancy research, just looking at a bunch of people who felt absolutely fine. And they MRI'd their back. And what they found is only about a third of the MRIs were considered normal. 36 out of 98. And this was so important, is that this was a top story throughout the United States of America. Anchor people on CBS, NBC, ABC, CNN, all mentioned this on the national news that night. And it was a front page story in the New York Times that day. So that's pretty important. This paper came out not in 2013, it came out in 2015, 2 years ago. And this is one of my favorite papers in the last 2 years. This came out in Spine, a major journal in terms of the spine, probably the most important one in the world. And they looked at not 98 people, they looked at 1,211 people without any neck pain. That's 12 times the amount of people that was in the classic landmark paper in the New England Journal in '94. And they found that only 13% of the MRIs were normal. 13! And in fact, they found all sorts of these spinal changes, and in fact, 1 out of 20 had evidence of compression of their spinal cord, but none of them had any symptoms. So I often say, and I'll say it now, that Dr. Sarno in some ways was kind of like the Nostradamus of spine care medicine. He had postulated this in the 1970s. So medicine in this respect kind of needed about 20 to 35 years to kind of catch up, almost 40 years. So here's the take-home point. If you're an adult, it is abnormal to have a normal MRI. That's the take-home point there. This was in the New England Journal 4 years ago in March. They looked at almost 300 patients with herniated discs in their back and sciatica, which is when the pain travels down into your leg, sometimes with numbness too. And they were all looked upon for a year. And any or all of these patients could have had surgery, didn't have surgery. If they decided first not to have surgery, they could then change their mind and have surgery. Then they all had MRIs a year later. and they were all re-examined, and they were all given a careful history. So the point of this paper was that if you looked at the MRIs of these people's backs a year later, there was no predictive value. Some people, their MRIs looked better, the patients felt worse. The MRIs looked worse, the patients felt better. So this is even a 2-year ago update on the paper from back in 1994. Again, those of you who are familiar with Dr. Sarno's books will know that there are 2 of our favorite spine surgeons are mentioned. This is a guy named Dr. Hubert Razumov, who was a big-time spine surgeon in America, and he did something that was very heroic about 30 years ago. He essentially stopped operating on people's backs because he thought that in virtually all of the patients, about 99%, he thought that all of these structural changes were meaningless. But he wasn't a psychologist, a chiropractor, physical therapist, or someone else. He was a spine surgeon of some national, if not international, renown. This man is very, very special, Alf Nachemson. He was considered, in fact, this book that I've been recently reading, considered the preeminent spine researcher of the 20th century. That's pretty important. He actually founded the journal called Spine, and he also thought that most of the time you cannot find a structural cause for back pain. So I mentioned these people to all of you because as I'm trying to understand and sort of make sense of what Dr. Sarno was trying to teach me, is it certainly was reassuring for me to see that there were not just some kind of reasonable doctors, but some globally respected physicians, particularly who were surgeons no less, who were singing not the same exact tune, but were singing a similar tune to Dr. Sarno. Briefly, what else did he talk about? He talked about psychosocial issues, job stress, job dissatisfaction. A surgeon was talking about this. This sounds like, crazy. But he realized that if you really understand people's psychosocial factors, those are much more important than the structurality, by and large. And he said something very interesting. He said, the spine is a mirror for everything that happens in life. This is Nachemson. One other thing, if you look at the bottom bullet point, he said that, Dr. Nachemson said that he thought that the idea that sitting was bad for your back, that sitting was bad for your neck, was pure mythology. He said that about 10 years ago. Doctor's visit. So when I see a patient in the office, again, the history is really the key part of this, probably even more important than your examination. Sir William Osler, considered the most influential physician of all time, even more than the great Hippocrates and others. He used to say, listen to the patient. He's telling you what's wrong with him or her. How powerful is that? Most influential physician of all time said about the history, how key it is. And what are the other things we talk about? Where exactly are your symptoms? Now, there may be 1 or 2 people in here, maybe not, who have actually seen me in the office. And I'm really a pain in the neck because when someone says, my pain is traveling down my leg, I say, that's helpful, but I need to know exactly where it is. Exactly. And the reason why is because what I haven't said yet, but it's important to say, is every once in a blue moon, the things that we do see in the MRI can be a problem. But solving puzzles professionally for a living, based upon where the symptoms are and where the symptoms aren't, I can then make a determination if the MRI findings mean anything or if the MRI findings are meaningless, which is the case most of the time. Of course, the physical examination is absolutely essential. You have to be able to examine the patient. These are some of the other key things we want to talk about, particularly the bowel and the bladder function, any sensory changes. These things are critically important to ask our patients. And look at that slide. That slide's a very busy bullet point. I can't say I ask every patient every history of these things, but I try to do this almost all the time. And you can see just a whole slew of other types of conditions, symptoms, diagnoses, which may also be what we would say under the TMS Sarnonian umbrella. And then, of course, your examination. I'm not going to be generally listening to your heart or your lungs or your belly, but I'm going to be largely focusing on the neurological systems, the musculoskeletal systems. These are very, very important. And this is just going into that in a little bit more detail. You have to do these things. You can't do these things just by talking to the patient. That's key, but you have to examine them. And of course, you have to review the blood work. One of the commonest things I hear from some great patients, they say, you don't want to, you guys think this MRI stuff's for the birds or it's useless. No, I like to sort of see the data, because the more information I have to a point, the better I can help a patient by trying to help make a proper diagnosis. 300 or 400 pages of data is probably a little too much for a visit, but the key information is usually what we need, usually within about 10 pages or so. Blood work, radiology reports, what other doctors think. There are still a lot of smart doctors out there. We're not being dismissive of every physician who's out there. Sometimes they have very important things to tell us. Differential diagnosis. What is that? That's just sort of, what are the possibilities that the patient could be having? Sort of, do you think there are 2 things going on, 1 thing going on, 20 things going on? That's what doctors are supposed to do. They take a history, they do an examination, and then they sort of say, what are the possible suspects of the crime? Bring them into the police office and figure out what the real culprit is. Is this TMS, what we'll call the Dr. Sarno diagnosis? Is it not TMS? Am I not sure? Is this what we call a TMS hybrid? What's a TMS hybrid? In my experience, this is a very rare situation, but it's when a person may have TMS plus something else. For example, someone may have unfortunately had a cancer diagnosis and they needed some chemotherapy to help them beat the cancer, and there are certain chemotherapy agents that can cause a neuropathy. Okay? And that would be not TMS, for example. There are many examples. Some people think, and very intelligent people think, that every single patient that Dr. Sarno saw in the office, he thought this was TMS. Not true. Remember, I saw with Dr. Sarno more patients than every physician who studied with him combined, because I had about a 20-year history with him. Other physicians who spent an occasional day or two may have seen 4, 5, 6, 7 patients, and maybe in those 2 days, everyone was a TMS diagnosis, but not always. So you have to keep that in mind. And then what's our treatment? Again, to the uninitiated, this sounds absolutely ridiculous. Remember, I was an intern in general surgery. I wielded scalpels, held retractors, all sorts of things. This is the total other side of the spectrum, from actually invading someone's body to heal them to actually teaching them. Education as therapy. I think there have been some quotes about knowledge is powerful medicine, things like that, and it's really true in this situation. So I do this in a 2-part session, 75 minutes each. Part 1 is the anatomy and physiology. We talk about the body. Then we talk about the psychology and the treatment strategy. So let's talk about that a little bit so we can make this a little clearer to all of you. Some key points. Your body is healthy and normal, at least the organ systems in your body that I have addressed. Your brain is healthy and normal. This is not the situation behind a crazy person. And although this has been said in so many words so far this evening, when someone's under a sufficient amount of stress and or tension, the body will actually create physical symptoms to divert attention from stuff that's going on inside of all of us. And it's been said before, but it bears repeating. These symptoms are real symptoms. They're not all in your head. They're all in your body. But they are coordinated, orchestrated by your brain. So these are real symptoms. And it's really sad that every now and then, probably more now than then, patients will say that one or more healthcare providers sort of was dismissive of their symptoms and thought that these symptoms just couldn't really be real. I think people who come to see me in the office have 1,000 better things to do with their life than come see a doctor. So they're not fabricating their symptoms. and the cure through knowledge. So, how does this seem to work psychologically? What I tell my patients, and I'll tell you, is you have to take something to kind of take it on faith, that our brain, our mind, creates emotions and feelings on a fairly consistent basis, whether we feel them or whether we don't. And they're largely housed in this part of our brain we call the unconscious. And when the brain wants to make this whole TMS or a TMS equivalent happen, it won't outsource, it will insource the part of our nervous system called the autonomic nervous system. And it creates a process which is remarkable as a physician. It doesn't cause damage to your cells or your body, but it can cause severe disabling symptoms. It's the real sort of epitome of walking up to a line but not crossing over it. Severe disabling symptoms, but not damage to your cells or body. It's absolutely remarkable how it does this. So you see these things up on the slide: decreased blood flow, mild oxygen deprivation. That could be scary to patients. We're not talking about a stroke, God forbid, a heart attack, God forbid, gangrene, God forbid. Those are serious oxygen deprivations. TMS is harmless and can create a whole smorgasbord of symptoms: pain, numbness, tingling, sensory loss, weakness, etc. These are the key areas where TMS are affected: the upper back, lower back, and up by the neck. But it's not just there. You can have symptoms in in any of your upper or lower limbs. And nerves can be affected too, in the upper body, middle body, and lower body. And that's where these sort of scary terms like cervical and thoracic and lumbar and sacral sound scary, but it generally is not scary at all. And what's really remarkable, and I'm seeing this even more in the last 5 to 8 years, people are often coming to see us with tendon pain that nobody can explain. See good clinicians, have all kinds of studies, and not much of anything. And this can involve the knees and the shoulders and all sorts of other parts of your body. And what's really remarkable, and this is stuff that's not even in the Divided Mind, which is the last book Dr. Sarno wrote, is that if you, similar to the neck and the back and the discs and all that other kind of stuff, if you MRI enough people's wrists, shoulders, hips, knees, ankles, you're going to find stuff that doesn't look so perfect, but in people without symptoms. Equivalence. Dr. Howard Rusk wrote a book that came out in 1972 called A World to Care For, about rehabilitation. And without trying to sound overly smug about this, I think in TMS and equivalency, there is a world to care for. Because beyond pain, and pain is huge, there are all these other things that could be affected also. And we think in most situations, these are what we call TMS equivalents. So, ladies and gentlemen, if the medical profession isn't quite ready yet for TMS as a source of pain, Dr. Sarno was probably generations ahead of the medical profession in terms of all of these equivalents, which are also very significantly disabling symptoms that seem to be caused by the same process as TMS is. So what are the strategies? We heard about this through the rabbi, through Dr. Sarno, that nice video that we saw. All right, you have to be able to say, I have nothing structurally wrong with my affected body part, nothing metabolically wrong with my body part, and you have to really believe this. But let me say something that I often say to my patients. If I were grading you, if I were your professor in a course, I would give you a B for belief. And B is a good grade. There's nothing wrong with a B, despite what you hear sometimes. And belief is very, very important in healthcare. There's no doubt about it. But to get an A, you have to accept it. What's the difference? if possible. To me, accepting the TMS diagnosis or accepting the equivalent diagnosis, other body symptoms involved, there's got to be some concept where you say, this makes sense to me. Because we know in belief, I'm not an expert in belief, there doesn't have to be any logic involved. But if you can accept it, and that's what really excited me about this work 27 years ago, is this all made sense to me. Think psychologically. This is hard for a lot of people to do. You want to think about structural, medical stuff. In some ways, it may be, in some cases, almost easier. Do's and don'ts. Remember, I haven't said this, but both Dr. Sarno and I, our field of medicine is rehabilitation medicine. In fact, the other term for this is physical medicine and rehabilitation. So talk about the courage of Dr. Sarno in the really early 80s when he really started to do this on a much grander scale. He would say no physical therapy, no chiropractic. That was so, what's the word? Just so against the heretical almost, would probably be the word that comes to mind. So iconoclastic, so totally in the different way that other doctors are thinking about this. The do's, again, and the handout that we provided for you gives you a lot of the do's as well. The fear factor. I think a lot of doctors don't often talk to patients about that. The fear factor can be huge. That the diagnosis, physical activities, I think the rabbi, the MC, said this beautifully. He said, when he went to Dr. Sarno and he was concerned about skiing, Dr. Sarno said, go skiing. Now, before any of you think I'm a kook, and you certainly can, is if someone came to me with a broken ankle, I wouldn't say to them, maybe you should go run on that broken ankle. That would be a really good idea. No, that would be stupid. It would actually be totally inappropriate. Or someone, unfortunately, broke their hip. No, you'd want to first make sure that they had their broken hip treated and properly rehabilitated. Some of you may know I also have a little bit of a history in taking care of stroke patients. So if someone who unfortunately has had a stroke, I wouldn't say to her or him, especially if they're paralyzed, go out and run. That, of course, is inappropriate. For TMS, it is appropriate. Fear of injury, recurrent symptoms. This is a very legitimate fear that people have. It's not legitimate in TMS, meaning that in the final analysis, you don't have to worry about it, but people can have those fears, particularly if they've seen anywhere from 1 to 40 other doctors, and they tell you something completely different. And that needs to be respected by me, that I'm not the only physician that they've seen most of the time. Personal consequences. This could be very painful. Most people have families, social networks they're with, and to have this type of symptoms could be very, very difficult, not just on them, but on their families, their friends, and something as simple as, I can give you probably hundreds of examples, but people who, let's say, they have children, and whether it's a mother or father, and they say, when I'm not doing so well, just how my kids feel about it, they think. So this is important too. What value can I add as a physician? I can confirm a diagnosis one way or the other. Fortunately, the overwhelming majority of people that I see have TMS or a TMS equivalent. But if I don't think that they do, I will tell them that straight out and then steer them in another direction to help them as best as we can. Validate the patient's symptoms and situation. I think I alluded to that last time. Rather than being dismissive, saying pejorative terms, nobody wins with that. Therapeutic information. Truly, information is therapy. It's remarkable. Some people will do very well, but months or years later, will have a recurrence. That doesn't make you a failure. It just makes you a human being. So I encourage people, if that does occur, let's take a look. We'll look at this together. We're not going to come in with blinders on. If this is a recurrence, we'll help you through it. And if for some reason it's not, we'll steer you in another direction. In addition to treatment lectures, as Dr. Sarno did, I also run small group meetings. In a lecture, I do the talking, we have some Q&A, questions and answers. For the most part, I'm the one talking. In a small group meeting, I hopefully do very little of the talking. I'm a moderator, a facilitator, and we ask our patients to open up a bit. It's interesting, quick story. In 2000, Dr. Sarno and I went out to San Francisco where he was giving a keynote address at the American Academy of Physical Medicine talk. And you may have heard of this guy, Dr. Dean Ornish. He's a cardiologist out at the University of California in San Francisco. And he was one of the first doctors to show improvement in heart disease through his special program. And Dean Ornish used to talk about something called the Open Your Heart program. And even he, out in San Francisco, in that area, would have these support groups and found that that was an integral part of his treatment as well. Now, this isn't for everybody. Not everybody wants to open up about their symptoms and their life situations, so that's ultimately going to be up to them. And yes, referral to a psychotherapist. What do you think, I'm crazy? No. But the metaphor that I use, which is not the perfect metaphor, is baseball. Certainly, some of you may have related to this, but certainly one of my heroes is this guy named Sandy Koufax. He apparently was a pretty good pitcher in his day, I heard. Did pretty well. So if I think of myself as the starting pitcher of the game, and it's not a perfect metaphor, there's some imperfections in this. So if we can get the complete game and get the baseball victory, just the patient and myself, great. But what if we can't? We need to call in a relief pitcher. So in a sense, the relief pitcher is the psychologist, the therapist. She or he can do what I can't do. She or he could do what Dr. Sarno couldn't do, which is to help people be more aware of their emotional side. And what sold me on this approach as much as anything, as a skeptical scientific guy, is when patients who are having continuous symptoms needed to work with a psychologist and they started to make some even minor headway, their symptoms were invariably improving drastically. And after a while, it wasn't a coincidence, it was a cause and effect. Some of these are review. Common misunderstandings about TMS. Pain is all in your head. Wrong. The pain is not physical. Wrong. The pain is not real. Wrong. A physical examination is unnecessary. This is an interesting point, and we can talk about this in the questions and answers. Ideally, it would be better to try to get a diagnosis confirmed than not to. We didn't talk much about the personality characteristics. They are in your program, in your brochure, but people might think, well, I have to stop being a perfectionist, stop being a people pleaser. Wrong. And if there's all this sort of psychological, emotional stuff, then in order for me to be better and stay better, I have to kind of get rid of all this stuff. Wrong. And TMS can be the cause of neck and back pain, but can't be the cause of pain elsewhere in your body. Wrong, wrong, wrong. TMS can be afflicting different body parts, not just the neck and back. All pain and all physical symptoms are due to TMS. Wrong. I think we talked about that before. And medication is a no-no. Wrong. I hear this very frequently. Oh, Dr. Sarno was against medications. Wrong. We weren't certainly very excited about over-medicating people, but sometimes medication was necessary. This is a 42-year-old man, I don't remember this by heart, so I have to look at the slides myself, who had lower back pain and some tingling in his legs. He had seen another rehab physician and ordered all sorts of studies that apparently showed nothing serious. He read one of Dr. Sarno's books about 3 months before, and actually by the time he saw me, he was feeling well, but then he had lost his job a week before the visit, and it turns out that his symptoms began to worsen again, and he had some history of migraine headaches and hives. His examination was normal. His MRI of the neck showed a herniated disc and severe spinal stenosis. His low back MRI showed 3 herniated discs, but based on the normalcy of his examination and the rest of his history, the diagnosis was TMS, and he did very, very well with complete symptom resolution. I thought this was just a nice homage to Dr. Sarno. This is about a little under 4.5 years ago. In Forbes.com, Edward Seidel wrote about Dr. Sarno. He called him America's best doctor and his miracle cures and how America's best doctor took on the medical establishment. So I thought that was a nice tip of the hat to the great Dr. Sarno. And again, tonight's lecture is for educational purposes. Always consult with your physician. Don't take chances, at least is my opinion. It's been a privilege. Thank you.